I know we're not seeing it here, but let's start with blood. If I were to ask you questions that relate or pertain to the lab for blood, what would I ask you? I would ask you about the histology of the blood, correct? So what does blood look like? A blood smear. We should all be comfortable with a blood smear, right? Red blood cell, white blood cell, thrombocytes, you should be able to clearly discern that. You should even be able to tell me if it's a neutrophil or basophil, eosinophil. Do you guys remember we talked about granular versus agranular? You may see some slides in there that deal with that, okay? So are we kind of comfortable with that? We should, I know I don't have one here in front of me, a model, but we should know, or maybe we do, hold on. Maybe this yeah. So, I mean, I wouldn't show you this poster board, but if I were to show you like this image down here, like the ones that we've had in the PowerPoint, which is what I do show you guys, what would you guys say to this?
Neutrophil.
Well, I mean the whole thing, blood smear, right?
Blood
and then
smear.
yeah, if I ask you about a certain one like that one there, you'd be like, that's a neutrophil, right? So that's fair game, right? So we want to understand the histology of blood. I think that'd be it in terms of the lab aspect of it. For blood, I'm trying to think of anything else. I think histology is the only thing that I could ask you on it. On the mannequin here, the model, we want to be very careful with the vascular side of things, okay? Do you guys remember like heart, cardio, all this good stuff here at the heart? So if we look at the heart, what are we seeing here? Who knows what this structure is?
It's your auricle.
Auricles, right? So don't confuse auricle with, I think sometimes on the models they kind of give you the atria like on this side, if you guys have studied them. Have you guys studied them? No? Well, study them. Because the appendage is the auricle and the chamber is the atria, okay? We have two atria, we've got two ventricles, okay? So those are important to keep in mind. If we open it up, we should note which one is right, which one is left. We should know what number 5 is. Again, don't take the number literally because it's going to change, but there's a little kind of, it used to be an opening, now it's not, it's sealed up. Fossa ovalis, okay? Fossa ovalis or foramen ovale? Which one is it? Fossa ovalis. In fetal development, what is it called? Foramen ovale, right? So commit to an answer, guys. Shout it out. It's okay if you're wrong or right. I want you guys to learn. From there, we should know blood flow dynamics, how blood flows, right? We should know that if we're talking about drainage, we're talking about 3 structures emptying into the right atria of the heart. Which are the 3 structures? You guys go ahead and tell me.
Superior vena cava.
Superior vena cava is one. Inferior vena sinus, and then somebody shout out coronary sinus. Very good. Coronary sinus, if we kind of flip the heart around, if we turn it around, you see this giant vessel right here. You have a bunch of other smaller veins that kind of unite to form one big vessel, and that big vessel is the one that we kind of want to know. And that one is the coronary sinus. Where does the coronary sinus empty into? To the right atria. And you can actually see the opening here, like I think it's number 6, right? So if you look at it, there's like a little opening, and that's the opening of the coronary sinus into the right atrium. Okay, so those are major structures that we should kind of keep in mind and note. And then lately I've been kind of on a trip about asking what's unique about the atria, what's unique about the ventricles. So I think I asked it to you guys a couple times during lab. So give me the unique structure that's found in the atria. The pectinate muscle. Very good. The pectinate muscle is unique to the atria. More so on the right than the left, but it's there, pectinate muscle. It's a unique feature found in atrial muscle. So blood's flowing here, it's in the atria. It passes through what valve?
Tricuspid valve.
Tricuspid valve on the right side, very good. It's going to enter the right ventricle, and then blood's going to eject through what structure?
Pulmonary trunk.
Pulmonary trunk through what valve?
Semilunar
valves, right? So the pulmonary semilunar valve or SL valves, very good. So from there it goes into the pulmonary trunk. From the pulmonary trunk it goes to what structures?
The lungs.
The lungs, but through what structure? What structure?
Pulmonary circuit.
Pulmonary. This is where everybody's confused. Is it the pulmonary veins or arteries?
Arteries, because it's in the
Zoom in on
heart.
this one. Pulmonary. Pulmonary what?
Arteries.
Arteries, right? Because the definition of an artery is what?
Leads away from the heart.
Away from the heart. So where's this blood going? Away from the heart. Hence, artery. Even though it's carrying what type of blood? Deoxygenated blood. We're going by definition, right? And the lungs, it gets oxygenated. Blood goes back from the lungs to the left side of the heart to the left atria via these 4 little structures that penetrate the left atrium. Pulmonary veins. So we should be confident in that, okay? Because again, when we do test day, it's going to sound very similar. We want to be sure of what our anatomy is. Pulmonary veins. I forgot again. Veins? Veins. Okay, good. Why?
Goes to the heart.
heart, so I'm not confused, right? Okay, very good. From there, it's going to drop down into the ventricle through what structure?
Bicuspid valve.
Bicuspid or mitral valve. It's important, so important they gave it two names, right? Because we care about the left. The right, don't really care about, right? Left is more. Okay, so from there, where's it going? It's shooting up this other valve. Aortic SL valve, and then from there, it's going up the aortic arch. Well, it's gonna go this way. You're right. It's gonna go up the ascending aorta, aortic arch, and then descending aorta. Does that make sense? Okay. So if we kind of close this up for a second, you can't actually see the openings of the coronaries at this point in time, right? They're kind of hidden, but if we open it up, you can kind of see those little points. Do you see that little point right there? One on the right, and then one on the left. Okay. Those are part of the ascending aorta, and part of the ascending aorta branches into these two little structures called the right and left coronary arteries, right? And the right and left coronary arteries, are they important?
Yes.
Definitely. Because what are they feeding? What are they supplying? Heart muscle. What? When we say heart muscle, what are we saying?
Myocardium.
The myocardium, okay? That's what it's mainly supplying. And we have the right, we have the left. Where is the left Where is the circumflex artery located, right or left? Left, right. So you should note, your circumflex artery is this way, right? So note that your circumflex artery is this way. It's kind of going around the back. It's supplying the majority of your left ventricle. What's the other one that's kind of going down this way? Left anterior descending, I think, right? Your lab, right? Left anterior descending as well. You've got your right side as well. Not as important, but you just want to keep those structures in mind, okay? So we have coronary in play. We've talked about all these structures here. What's another one I can show you? Oh, this one here. There was a union between aorta and pulmonary trunk at one point in development. You can kind of see it now as this little white ligament. Can you guys pick that up? There's a little white ligament between those large vessels. What is the name of this structure now? Ligamentum arteriosum, right on, nice. What was it during fetal development? Ductus arteriosus, very good. Because again, what's not in play? The lungs, right? So these are all structures that we should definitely know, just simple anatomy, right? So for the heart, I think that is the majority of it, if not all of it, I think, what I want you guys to kind of keep in mind. So you guys get what to review, right? Heart anatomy, blood flow dynamics. We looked a little bit about vasculature as well, okay? So we're looking at multiple things in one, right? You guys get that? Following me? Okay. So from this point on, we said that the aortic arch is going to kind of split off into three, right? Three segments. What is the one segment that we're seeing on the right? Right brachiocephalic artery. Then we have the left common carotid. Then at the end we have the left subclavian. Okay? The right brachiocephalic is going to bifurcate and create or form what we just saw on the left, correct? So on the right side, the brachiocephalic bifurcates into what structures?
The right common artery.
Right common carotid
subclavian.
and the right subclavian, correct? Okay. If we look at the subclavian, do we have an arm? Somewhere are they over there? Arm. Can I get that arm real quick? All right, thanks. Just grab that. Okay. So if we look at this, look at this one here. Let's kind of pull it apart a little bit. Okay. So if we're following the dynamics here, the subclavian artery is going to give rise to what artery to feed or supply the upper arm. Because these structures that we're talking about here, these vessels, they're supplying the trunk, the head, the neck, the upper limb, right? That's what it's supplying. So let's go with the first one here. We're going off subclavian, correct? Subclavian becomes what?
Auxiliary?
Auxiliary artery, right? Or the armpit artery, okay? The armpit artery. And it becomes the armpit artery if we kind of trace it out right here. You can kind of see it here. This is the auxiliary artery. And there's a muscle that kind of delineates or denotes its demarcation. You guys remember that name of that muscle? Teres minor. Very good. Teres minor. That's what we're pointing at right there. By the way, that's a teres minor. Okay. Part of your sits muscle group, right? Or not? Or is the major part of the sits muscle group? It's the minor. It's the minor. Okay. The major is not part of your rotational cuff muscles. Anyway, so as we descend this way through the teres minor, it's going to kind of change into another artery. This is the one that we kind of take blood pressure with. The brachial artery, right? This is the one in the arm, right? So what muscle is kind of overlying it? If we kind of hold it this way, you can kind of see the muscle, the bicep. And what muscle is kind of underneath it? Well, tricep would be on the opposite side. What's more? I told you, yeah, I did see you guys last time. Say it again. Brachialis? Not brachialis. Oh, no, you said brachialis, right? Brachialis, no, you're right. Brachialis is correct.
So I was like,
Yeah, brachialis is correct. I thought you were saying brachioradialis or coracobrachialis, not those. But brachialis is correct. The brachialis is basically the workhorse. The biceps is the show horse, right? So everybody wants to flex the bicep and look at it's big, but the one that's doing the work is the brachialis. Anyway, as it kind of passes through what structure? The antecubital fossa. Antecubital fossa is better known just simply as the bend of the elbow. As it passes that bend of the elbow or the antecubital fossa, it's going to kind of bifurcate. We'll take some of these muscles off, and you can kind of see as it bifurcates into two other large vessels. Okay, one is going to be on the medial side, one is going to be on the lateral side. So when we say lateral side, remember anatomical position. Thumbs are where?
Out.
Out, pointing out, right? Palms are facing forward, correct? So anatomical. So which one is the one that's in line with the thumb?
Radial artery.
Radial artery, that's where we feel the radial pulse. The one that's medial is the ulnar artery, right? So those are the major vessels, I think, of the upper limb that we want to kind of keep in mind and note. Are you kind of comfortable with the upper limb, where it arises from, all that good stuff? Okay, so that's one. So that's this one. Now let's kind of go back and trace this other artery that's kind of going up, right? What is this artery that's going up? That I'm
Carotid artery.
The right common carotid, very good. Even give you some right common carotid and the left common carotid. Okay. If you guys note, these arteries are a little bit deep to the jugular veins. Okay. So sometimes when people have venous distension, they see or have the interpretation that the veins, the jugular, actually has a pulse. Does it? No. We've looked at this with vascular veins. Are almost at zero with a pulse, right? You can't really see a pulse on them. What you end up is with a rebound effect of the carotids and this bounding effect, giving you the impression that there is a pulse to the jugulars, right? So as we kind of ascend through the neck, the common carotids, they bifurcate, and you can see here, right at the beginnings there, you can see at the beginnings here, and then more so, I think that's about it, here. They begin to kind of branch off into the internal and external carotids. Do you guys remember that? The internal and external carotids. The internal carotids are important because what's happening there? They're going to feed mainly the brain, okay? And the external carotids are going to feed the face, the scalp, but one part of the brain that we should note, the outer covering of the brain, and the dura mater is part of what? You're kind of right, yeah? The meninges. And the dura mater is part of the meningeal layer, right? So you have the dura, the pia, and the arachnoid matter, right? So yeah, definitely. So the meninges, right? Okay. And then, so that would be which one again? The internal carotid?
External.
Ah, okay, good. Okay, you guys are on it. External carotid, correct? Good. Internal is feeding the brain itself, okay? So how does it do this? If we pause this for a second and jump to this guy, what's going to happen now is, okay, as the internal carotid bifurcates and kind of separates, it's going to find its way up through these very specialized holes or foramen that are found in a bone, a cervical bone. What is the name of that cervical bone? And what is the name of that opening?
Transverse foramen.
Transverse foramen. And that would be the cervical vertebrae,
Yes.
right? So all the cervical vertebrae, C1 through 7, right? They all have this unique, distinctive marking, which is the
Two holes.
transverse foramen, the two holes on the transverse side. Okay. No other vertebrae that you have are going to have that. Only the cervical. And as they kind of ascend, as you're seeing in this kind of model, you have the right and left artery, but now it's not called the common anymore because we went internal and then kind of bifurcated and kind of changed into another artery. The name is different. What is the name of the artery that passes through these foramen, these vertebral arteries? Very good. And the vertebral arteries are going to join. If you look very closely, you can see how, I don't want to stretch it out too much because it's going to break. But if you notice, can you guys see that? How it's 2 and then it joins as 1. You guys see it on this side? Where it was 2, it becomes 1. So the two vertebral become one what?
Circle of Willis?
Well, the circle is the whole thing. That would be the whole thing. Where does it kind of begin? Does this guy have it? Well, I guess you can kind of see maybe the beginnings. No, that's not the best view. I don't think we have a brain. I think this. No, this. Well, I guess you can kind of see this one. maybe this one right here is the beginning of it. What is the name of this vessel? So we had the vertebral arteries, they unified into one.
Posterior.
What is it? Before it becomes the circle of Willis.
It's not basilar.
It's basilar. Yeah, the basilar or basilar artery, right? That's what we're talking about. Okay? That's this one here that we're seeing, the base, no?
Okay.
Then
Base,
the base, right? And then you're going to have what? Now you're going to have the circle of Willis. So what's the first part or segment of the circle of Willis?
Posterior.
Posterior cerebral artery. Yeah?
Yes.
Because where are we?
The
The posterior side of the brain or cerebrum. Hence,
Artery.
posterior cerebral artery. Then you have to have a point of communication. So we're going to have
Posterior communicating.
posterior communicating artery. Then you're going to go anterior
Anterior.
cerebral artery,
Anterior
communicating artery. And you just mirror that on the other side and you just created the
Circle of
circle
Willis.
of Willis. Or what is it called now? It's got a different name now, right? Is it cerebrovascular circulation now or something like that? I'm going to write it as circle of Willis so you guys know, but it's got a different name now in case you can't find it. So that would be all of our major vessels that we can kind of see here in the head, the neck, and the brain. I guess good with that so far? Okay, very good. Now we're going to put this guy away, and we're going to jump back to our model. So we did carotid, we did subclavian. What's left? Carotid, subclavian. Then we got to go, we did brachiocephalic. So brachiocephalic, we said it branches up into both. So it should be mirrored on either side, correct? So we kind of got that one. Okay, what else is next? That's the major structures there on the model. So we're talking about lab, right? Don't forget that, right? This is all part of lab, right? Not lecture so much, because I can get more detailed in lecture versus lab, yeah? In lab, I can't ask you about something you can't see. That's my philosophy. I mean, that's what I like to do. I like to ask you about what you can see. For the lecture, I can ask you more detailed stuff that you maybe are not able to see in the model, but can I ask you that in lecture? Yes or no?
Yes.
Yeah. You should say yes, because then you're like, you didn't tell me that. Yeah. Okay. Everything that we see in class is valid. For the lecture portion, lab portion, you get a little benefit because you have the model. So you can't be like, I don't see the the ethmoid bone. You can't ask me about the ethmoid bone. Okay. All right. Okay. Whatever. What's next with this model for vascular? We talked about that. Okay. So we have the descending aorta. As it descends, it becomes part of what structure? What is this? What is this? Mark, don't fall asleep on me now.
Thoracic vein. Thoracic artery.
Thoracic aorta.
Aorta.
Right, thoracic aorta. And then that's going to penetrate the diaphragm. Okay? And we have some branches of the thoracic aorta, meaning the branches of the thoracic aorta are going to supply certain organs in the thoracic cavity. What are the arteries or structures that are supplied by the branches of the thoracic aorta?
The lungs.
Bronchial artery, that's one. Because your right and left primary bronchi are there, so you're gonna have the artery. So think about the structures that are here. Don't be like gastric artery. The gastric artery is not up here, they could be down here, right? Just don't be like gonadal artery. I don't know where your gonads are at, but they're not up here, okay? And gonads should be down there, okay? So go with what's in this region. So you've got bronchial arteries, that's one. What if we put this guy back to help you guys out? There's something that covers the heart.
Mediastinum.
I shouldn't say covering the heart. The cutout of the heart, I should say better.
Steinum.
The mediastinum, you had it right the first time. The mediastinal artery. So you have the mediastinal, you got the bronchial, that's two. What else is here? What's this two? Esophageal. Okay, esophageal. What else? Is that it? Is that three? Is that we said three?
Yes.
Was there one more?
I feel like there should be. You're asking
Not tracheal. I think it's going to be the pericardium as well. So pericardial artery as well. Okay? The pericardium. So mediastinum, pericardium,
pericardium as well.
bronchial, and then what was the last one that we talked about?
Pericardium.
No, esophageal. Esophageal. All the major structures here. Lungs get their own supply somewhere else. We're going to see that when we see respiration today. Okay, so don't worry about that. And that's the one that everybody confuses it with. Okay, so don't confuse that here. As we kind of go through here, we have the abdominal aorta, right? with the abdominal aorta, you can kind of see the divisions here. What is that major division that we're seeing here? Or that major branch, I should say. The first major branch of the abdominal aorta.
Celiac trunk.
Celiac trunk, right? And the celiac trunk, you can see like it looks like a little coat hanger. So there's bifurcations. And the bifurcations are going to feed different organ systems here. The liver, the stomach, the spleen, the pancreas, the first segment of the duodenum. You guys remember all those structures in lecture? Go back and review those, please. Okay, those are really important when it comes to vascular. Okay? From there, what do we have? We have another vessel that feeds this organ.
Splenic.
Not splenic.
Renal?
The spleen is not here. What is that one? It's not the kidney, it's above the kidney. The suprarenal or adrenal artery. Right on. Okay, that's the one. Okay? I know you guys can't see. If you guys want to move this way, go ahead. And then you have what other artery? Renal. So how many is that so far? 3. Okay, how many more do we need to get to? 6? Right? 6? Okay, so there's renal. As we kind of descend down, what are we going to have? Say it again? What type of mesenteric? Superior mesenteric. And then what do we have? Give me the intestines. Where's the intestines?
They're on the shelf.
On the shelf. Okay. So now we're going to have, what break? Where are they? From there we have 2 vessels. We're kind of going out of order, but it's okay. We have, I think here it's saying, well they got numbers here, so we're going to say 2 and 1. You guys see 2 up here? What is 2 pointing to versus 1? How do we know it's superior?
It's on top.
Oh yeah, it's on top. Oh yeah, good. So it's the superior mesenteric artery, okay? And we should note what it supplies. That's a really important thing to keep in mind when we talk about vascular, right? It's like a little trap, right? So we want to be aware. What does the superior mesenteric artery supply? We can say it supplies all the small intestine, right? And it supplies a bit of the large. Does it supply the ascending colon? No? Wait, the superior mesenteric artery, I'm looking at it right here. So you said earlier superior mesenteric was number 2. You guys said that, right?
Yes.
Yes.
I agree with you.
Yeah.
Okay? So we're on the same page. If I turn it over this way, right?
Still on top. Yes.
So if we say ascending colon, right? Is that going to be supplied by the superior mesenteric artery?
Yes.
Yes.
Yes, it is. Does that include the appendix,
Yes, it is.
which is on the right side? Does that include the cecum, which is the first segment of the large intestine? Yes. The first segment of the large intestine called the cecum. Okay. Does it include 2/3 of the transverse colon?
Yes.
Yes, it does. So all those are innervated by, not innervated, what are supplied by what vessel? SMA, right? Right on. Then you have we're going out of order, but we're going to knock it out because we're in digestive. The inferior mesenteric artery, the IMA. So what structures are supplied by the inferior mesenteric? The rest of the transverse, the descending colon, right? Then you've got the sigmoid colon, right? Then you have the rectum, okay? And then some of the anus, okay? All those structures are supplied by inferior mesenteric artery. You guys got that one? Okay. From there, what do we have? We have a continuation of the rest of the vessels. How many are we down to? 2? Right? Or 2 or 1?
2.
How many?
No,
1. 1. We did inferior, superior. Last one down the list. Gonadal arteries. The gonads, right? Gonadal arteries. We each have a pair, right? So we should know it for sure, right? Testes, ovaries, gonadal arteries. Okay, that's what's applied there. From there, we're done with the abdominal aorta. Those are the big picture items. Now what do we have? It's going to bifurcate into something else. What does it bifurcate into? This is where everybody else trips up into. So here we were. This is the abdominal. This is the end of the abdominal aorta. It's going to bifurcate. You can see that right here.
Left and right.
Into right. Not femoral. Most common wrong answer. Femoral artery. It bifurcates into the.
Iliac.
What kind of iliac?
Left and right iliac.
What kind of left and right iliac? Common.
Common iliac.
And when they say common, that means it's going to bifurcate again into
The right.
Well, it's already right.
Inguina.
Internal, external.
and internal, external. Okay, internal, external. Very good. Okay, so the internal, you can kind of see how it's bifurcating in here, internally. You guys see that one? Okay, what is that going to feed? All the internal pelvic structures here. Okay, then as it kind of goes this way, this is the external. Okay, the external, once it passes the pubic bone, the pubic symphysis, what does it become? Now it's the femoral artery. Okay, so when you do coronary artery bypass graft surgery with that femoral triangle, That's part of the delineation of the femoral trine. Okay? So now we're here. You can see a bit of it peeking out there. That will be the femoral artery. Okay? From the femoral artery, as it kind of descends down, downwardly, as we pull these muscles off, begin to see the beginnings. You can kind of see it here. You guys see here? What is that?
It's the left common iliac.
The common iliac, and then you can see kind of become something else here. You guys see that? That internal iliac. You guys see that? And then the other one is the external. You guys see the pubic bone here?
Yeah.
Okay. After that, it becomes what?
Femoral
artery. Right on. And that femoral artery kind of like wraps around towards the back, and it becomes another major artery that we can feel, which is around the bend of the knee. The popliteal artery, right here. And then it kind of descends downward. Then you've got the posterior tibial artery, you've got the anterior tibial artery, and you've got the peroneal artery or the fibular artery. Peroneal and fibular mean the same thing, right? Then you have the digital arteries, right, to the digits. Are you guys cool with that? You guys all right with that?
Yes.
Dynamic, the blood flow, and that's about it for vascular, for the lab. For that, we should be able to also discern between an artery and a vein. So if I showed you a histology of an artery and a vein, I asked you like, what's an artery, what's a vein? Should you guys be able to tell me that's an artery, that's a vein?
Mm-hmm.
Hopefully you're able to do that. What else? So we did cardio, we did, what am I missing? Immuno is next. Immuno, again, it's one of those biochem kind of classes. Do you think I would show you, oh, I like hypersensitivities. So review your hypersensitivities. Okay, I might show you a chart or a graph or something like that that deals with hypersensitivities, and you should be able to delineate which one is what. So what causes a type 1, a type 2, type 3, type 4, just like we saw in the PowerPoints, I think. There was a little table there that kind of showed everything. What else? We should also be able to, any histology, guys, even if I don't mention it right now because I don't remember it, review the histology, okay? Because I will definitely ask you histology on it, okay? So just because I didn't say it today, I don't have a picture of it here, doesn't mean I'm not going to ask you histology. I've said it to you in every PowerPoint. Know the histology, it's part of your practical, okay? So for immuno, you should know your like tonsils, spleen, what else did we see? Lymph nodes, Peyer's patches, thymus, all those spleen we saw. I said spleen, I don't know if I said spleen. All those you should be really able to identify histologically. What else? What else are we at? Cardio. If I showed you cardiac muscle cells, we should be able to say that's a cardiac muscle cell versus skeletal or smooth example, right? If I were to do that. What else do we got? Respiratory is today. We're going to take a look at the anatomy of the respiratory system. I went through the groups with you individually, but in general, you should be able to tell me the flow of air, right? And everybody should tell it to me now quick, so we can kind of end it now. But if we're talking about the respiratory system, where does it begin? The nares. Then it goes into the nasal cavity, right? Nasal cavity, it's a very important structure, nasal cavity. You can see that on the medial side, it's delineated by those three little bumps, right? Those terminates, those structures. Sometimes they call them conchi, right?
Remove the leg.
Oh, conchi or terminates? You can't see through the leg? The terminates are conchi, right? So the terminates are conchi. Those are going to help increase airflow dynamics. They're going to help warm and humidify the air as we breathe it in. Okay, so you have the external layers, you've got the nasal cavity, the conchi's there. You've got a very rich blood supply that's also found there. And then what other structures can we kind of visibly see here? The pharynx, right? So there's three divisions of the pharynx. If it's in line with the nose, it's naso. If it's in line with the mouth, it's oro. If it's in line with the laryngeo, it's laryngopharynx, right? The larynx, laryngopharynx, okay? You should note the structures as well. Where's my model here? Let's kind of talk about this for a second. Okay, so you can't see that much with that model, but this model is a little bit better for respiratory. So with respiratory, if we start here, we have to understand the hyoid bone, okay? What's the fun fact about the hyoid bone that you learned in 201?
It's the most common bone broken during strangulation.
Okay, well, good. I was gonna say something a little bit more innocuous than that. Good, okay, if we're looking at the forensics, excellent, which is correct. How about something that doesn't deal with death?
The only free floating bone?
It's the only free floating bone or another bone that doesn't articulate with another bone. in the body. It's the only one. You can't feel it or palpate it. You can't feel or palpate this bone. It's a very deep bone. A lot of muscles attached to this point, so that's why you reviewed it in 201. You're going to see those muscles in respiratory today. Okay, so this is the hyoid bone. We have the hyoid bone. We've got a lot of muscles that surround it. We're mainly interested in the different types of cartilages that surround this bone. Okay, the main one that you're kind of seeing up in front, which is like shield-shaped, which is thyroid cartilage, right? Thyroid cartilage, it's the protuberance or the prominence that we can feel and palpate, okay? Below that one, that's gonna serve as a marker or point of delineation, I think it's number 3 here, right below it. Between the trachea and the thyroid cartilage above it is the cricoid, okay? So that's the cricoid cartilage right here below. Below that, we start the next structure, which you're seeing here, the C-rings, which would be what? Trachea, right? The trachea. So in this model, you can't really see the full extent of the trachea, but you can see the beginnings of it. You guys see that? Okay. So you should be familiar with the vascular aspect of it, yeah? That shouldn't be an issue. Cardio, we should be comfortable with as well. So I'm gonna just remove all this stuff here so we can see the inner workings of the other structures. Okay. So, what else did we talk about? Oh, let's take this one apart real quick. So if we take this apart, there's also another cartilage that's pretty important. It's this cartilage right here. Wait, where is it? On the backside. It's no, it's over here. It's right here. You guys see that one right there? So when we put it together, it's kind of like right here. It's spoon-shaped, and it tips over to prevent us from choking. You guys see that one right there? And on the opposite side is right here. You guys see that?
Yeah.
Okay. So what is the name of that?
Epiglottis.
Epiglottis. Epiglottis.
It's like in a jungle book.
Trying to pronounce these.
Epiglottis. It's a whole different language, yeah. So that's the epiglottis. It tips over to prevent us from what? Aspiration, right? We don't want to choke on fluids or food. So it does have a defense mechanism to it. Do you guys see those little white folds that are there? I don't know if you guys can make them out or not. The white folds, those are the true vocal folds. They're the ones that kind of crash together or vibrate together, or I think the term is undulate together to produce sound waves, phonation, right? So those are the ones that we want to keep in mind. I think those are the big high yield structures there. That's about it for that. This, okay, trachea, thyroid. You guys know this is a thyroid gland, right?
Yes.
Okay, so just note that. Where else were we here? So if we look at this structure, we should be able to say, okay, what is this? It's the trachea, and this would be what?
The main bronchi?
I hear a lot of people saying main bronchi, which is fine for now, but just note that they usually describe it as the primary bronchi, okay? Because they go by numbers. They go primary, secondary, tertiary, quaternary, all the way down to like 31 divisions of bronchi. They get smaller and smaller as they kind of progress. So we want to call them right and left primary bronchi. So those are important structures to keep in mind, just a note. You know the lungs, I just took them out, right? The lobes of the lungs. How many lobes does the left have? 3, very good. How about the right? 2, that's good. It's much more complicated than that, but we're gonna keep it simple for this one here. 3 and 2 is good. That's about it I would ask you, I think. Major muscle for respiration, we should know diaphragm. We'll talk more about this stuff in lecture as well. But for models, I think that's the majority of it. Histology, I don't know if there's histology. Well, I think there is histology. Let's take a look. Histology real quick. Respiratory. Okay. So again, I'm not going to show you the poster boards. I'm going to show you what we went over in the PowerPoints, but just so you get an idea, you guys can show me, where is this one? Simple, stratified, squamous, glandular. Oh, they don't have it. Simple cuboid, glandular, simple columnar. Oh, simple squamous, but this is not. It's not in the alveoli. But I guess it gives you an idea. This is simple squamous epithelium. Simple squamous meaning one cell thick, right? Squamous meaning what?
Flat.
Don't say square. Flat.
Flat.
Very good. Flat. Okay. Cuboidal would be more like square. Okay. Where do we find it? In the alveoli of the lungs. Okay. So if I showed you a histological cross section of the alveoli and trachea or bronchi, you should be able to show me. For muscles, we should be able to discern which one is cardiac. So is this one cardiac?
No.
What is this one?
Smooth.
Is it smooth?
Yes.
I can't see. Okay. No. Wait. Yeah, try to look at it better. So yeah, you're right. This is smooth. This would be what?
Cardiac.
Cardiac.
Cardiac, and this would be what?
Wait.
No.
Skeletal.
No,
Like
this
that.
is skeletal.
Yeah.
I'm not looking at the poster. I'm trusting you guys when you say what it is. And let me look at it now.
Skeletal.
Smooth,
Skeletal.
skeletal,
Skeletal.
cardiac. How do I know it's cardiac? I look for those
Intercirculated.
those intercalated discs. You guys see what number 6 is pointing at? That's an intercalated disc. An intercalated disc. It helps reinforce and strengthen the cardiomyocytes. Okay, so that's what we're looking for. What else? The models here, we should just kind of review, like I told you guys before, it's not a big thing. It kind of goes over what we already went over. You guys see all the numbers in circulation, right? Just blood flow dynamics. And then, what else is here? Yeah, just major vessels. Nothing major there to keep in mind. We should note valves, right, that are found on veins. There's no valves on arteries. Which one has the thicker tunica media?
The
Arteries. Okay, good. And then for respiratory, this is kind of like a mid-sagittal cut. Oh, we were talking about this earlier. I said I wish I had a mid-sagittal cut of the respiratory system, so you can see the bone. So the roof of the nasal cavity is formed by what bone? Ethmoid bone, right? And then what penetrates the ethmoid bone into the nasal cavity? What structure? Well, the olfactory bulb, and then from the bulb, the nerves, but the cribriform plates are the little holes, right, that allow for that nerve to pass through. And that's cranial nerve number? 1, right? CN1, very good. You guys know your 12 cranial nerves? Like my instructors always used to say, Colin, stand up, give me the 12 cranial nerves. So I had to learn them. So I learned way back when out of fear. I think I told somebody that the other day, that my instructor was really mean. I thought I told you that. And that's how it stuck. Of all ways to remember something out of fear, right, is the best way. But there's no fear here. It's all good, no worries. So we should just kind of remember respiratory. We're going to see more of this later. That's thyroid. That's cricoid. This is trachea, bronchi. We're going to take a look at the alveoli as well, okay, in today's class. So I think that does it, like a kind of an encompassing summary of the lab practical kind of stuff, okay? I think that's going to cover about 95% of things. If there's 1 or 2 things that I missed, that doesn't mean that you're excluded from being asked that question. It's just I'm trying to go over it as much as I can, kind of on the fly. I didn't plan this out; it just came to me right now. I usually don't do this, but you know, spontaneous moment, right? Why not? So there, whatever. I know. That's it. We're good. I want videos of all this. Okay.
So many views.
So many views.
Different angle.
Different angles.
360.
If I don't receive the videos, points will be deducted, okay? Because I want the videos. So I know you got it. I know you guys got it in front, a really good view. So that's what I want.